In the name of the law, Module 5P, Dermatology, Semester 5, Level 3. Today we will discuss bacterial infections of the skin. You can become in contact with me by official email or by mobile at WhatsApp. Learning outcomes. By the end of this literature, you should recognize etiology, clinical features, diagnosis and treatment of bacterial skin diseases caused by staphylococci and streptococci and corynebacteria. Case scenario. By the end of this literature, you should answer this question on this case scenario. A 4-year-old boy presented by mild fever with asymptomatic skin vesicle and poly on erythematous base with yellowish brown thick crust on chin and around the mouth. Nose started 5 days ago. What is your diagnosis and what is the treatment option of this case? You know that the skin protects itself by being a dry mechanical barrier, its acidity, and by its sebum secretion. Staphylococci commonly attack skin appendages like hair follicle, sweat glands, preangular tissue. Streptococci prefer skin proper. What is the disease caused by staph? Disease caused by staph include impetigo, frankel, and carbuncle. Disease caused by strep include some cases of impetigo, erysipelas, cellulitis, intertrigo, and angular cheilitis. Corynebacteria, which is common bacteria affecting the skin, produce disease called erythrasma. We will discuss disease called impetigo, which is a contiguous suppurative pyogenic infection of the skin and has two main clinical types, bullous impetigo and non-bullous impetigo. What's the etiology of impetigo? Impetigo has two main clinical variants, bullous impetigo produced by staph aureus and non-bullous impetigo produced by staph or strep or by both organisms. The predisposing factors for impetigo include overcrowding, malnutrition, poor hygiene, itchy skin diseases like atopic dermatitis, or minor abrasions. Clinical picture of impetigo. Impetigo has clinical variant number 1, non-bullous impetigo, also called crusted impetigo, which is more common in children, started by cell vesicle on erythematous base, transformed into pustules which rupture, giving yellowish brown thick crustation, dried and separates, giving erythema which fades without any scar. In this slide, you must know the definition of vesicle, pustule, crustation. Vesicle is a primary lesion which defined as localized collection of fluid in the skin which has diameter less than 0.5 mm. Pustules is defined as localized collection of pus. Crustation or crust, this means secondary lesion appear on the skin, characterized by dried sebum or dried secretion like blood or serous fluid. Okay, so when you read this slide, you must know the primary lesion, vesicle, pustule, and secondary lesion, which is crust. Why the impetigo healed without any scar? Because it is a very superficial bacterial disease, not affecting dermis. So healing of this disease healed by hyperpigmentation or erythema, not healed with scars. But when the impetigo deep, like the next clinical type, healed by scar, as we will see later. This photo show the yellowish crustation of impetigo. This is another photo of extensive involvement of the face with discrete lesions and confluent lesion characterized by golden yellow crustation around nose, around the mouth and chin. Second type of impetigo is bullous impetigo. Bullous impetigo occur anywhere on the skin, including palm and sole. Occur in all ages, including newborn. Characterized by, from its name, bullous impetigo, characterized by pulli, which first appear as clear collection of fluid. Then this collection of fluid become cloudy. The diameter of pulli 1 to 2 cm in diameter, which persists for 2 or 3 days. Less rapidly rupture when rupture, forming thin brown crust. And this type of impetigo rarely associated with regional adenitis. The primary lesion of bullous impetigo is pulli. Definition of pulli: you must know the definition of pulli, which is localized collection of fluid which has diameter more than 0.5 millimeter. This photo of bullous impetigo, which is characterized by discrete vesicle and pulli. Third type of impetigo called ecthyma, also known as ulcerative impetigo, characterized by thick crust and virulent irregular ulcer. Healing of this type of impetigo occur after a few weeks and heal with a scar, because this lesion involved to the dermis, so the healing of this type healed by the scar. This type of the bacterial infection of the skin usually associated with fever and enlarged regional lymph node. This type can occur anywhere on the body. Course of the disease. This slide include course and complication of the impetigo generally. Course of the impetigo: spontaneous cure in 2 or 3 weeks if the patient is immune competent, or may persist sometimes and improved with treatment. Complications include glomerulonephritis, especially in cases of impetigo caused by streptococcal infection. You can know the causative organism by culture from the pus of the lesion. This photo shows the type of impetigo called ecthyma, characterized by multiple ulcer with raised border, and healing of this type occur by scarring. The most common site of ecthyma is the leg, especially chin of the leg. What's the treatment options of impetigo? Treatment option, like any disease in dermatology, include topical treatment and systemic treatment and treatment of predisposing factor. Why you must treat the predisposing factor in case of impetigo? for two reasons. Number one, to improve the outcome and the prognosis of the disease. Number two, to prevent recurrence of the disease. Topical treatment in this case include topical removal of the crust by olive oil, by topical antiseptic and topical antibiotic. Systemic antibiotics for a case of impetigo occur in specific situations. What is the indication? This is oral question. What is the indication of systemic antibiotics for a case of impetigo? In case of extensive lesion, if the patient associated or complaining of multiple lesions, you must give the patient systemic antibiotic. If the patient complaining of fever, when you examine the patient and you see or you find enlarged regional lymph node, in case of bullous impetigo, in case of nephrogenic strain of streptococci, when you see a case of bullous impetigo and you do culture from the pus and the culture reveals streptococci, you must give the patient systemic antibiotic. What is the types of antibiotic you can give in case of impetigo? Number one, penicillinase resistant penicillin like fluoxetillin 1 or 1.5 gram per day. In case of infant and children, you can give 25 or 50 milligram per kilogram per day. In case of any sensitivity from penicillin, you can use another antibiotic called erythromycin, which is safe for treatment in case of pregnancy, in lactation, in children, or in case of sensitivity to penicillin. The dose of erythromycin 1 gram per day, or when you give the drug for infant or children, you must give the dose according to the body weight, which is 40 milligram per kilogram per day. And don't miss treatment of predisposing factor to improve the prognosis of and improvement of the disease and to prevent the recurrence. Second disease caused by staphylococci, which is furunculosis or boils. Furuncle mean acute staphylococcal infection of the hair follicle, sebaceous gland, and dermal tissue around them. What's the predisposing factor of furunculosis? Seborrhea or diseases seborrhea or increased sebum production, a patient associated with anemia or malnutrition, diabetic patient, fatigue, emotional stress. All of this are predisposing factor to produce furunculosis. What is the clinical picture? Clinical picture of furuncle presented by follicular nodule, which is red, tender, that increase in size, giving a firm cone-shaped projection surrounded by red areola. The center of this nodule pointed by pus. This furuncle may be single or may be multiple in some cases. Site of the furuncle can affect face, neck, arms, buttocks, anogenital areas. Complications of piles include if the piles present in the upper lips, cheeks, can be complicated by cavernous sinus thrombosis. Severe cases or immunocompromised patient can be complicated by sepsemia and bulimia. So you must treat any patient presented by furuncle, especially in these sites and especially in this situation. And this photo of piles, it is inflammation, so it's hot, red, tender, swollen, surrounded by erythema, and so on. This is a photo showed multiple piles on the trunk. It's another photo. What's the treatment option? Treatment option include topical and systemic antibiotic even surgical incision and drainage of the pus, and treatment of predisposing factor, which drain the pus from multiple orifices, as you see in the picture. Now we will discuss diseases caused by bacteria called streptococci. As we said before, diseases include some cases of impetigo, cellulitis and erysipelas, angular cheilitis, cellulitis and erysipelas mean streptococcal infection of dermis and upper subcutaneous tissue. The clinical picture of erysipelas and cellulitis similar, but there is small difference between the two diseases. The patient clinically has general manifestation of infection, fever, headache, malaise. The skin shows bright red edematous plaque, which is erythematous. The main difference between erysipelas and cellulitis, the erythema of erysipelas well defined, but in case of cellulitis the lesion is ill-defined red erythematous plaque, which is painful, tender, showing vesicle and poly develop on the lesion, may be hemorrhagic, especially in elderly. Erysipelas and cellulitis can affecting any side of the body. For example, abdominal wall, may affecting face, scalp and limbs. Without treatment, the course or the lesion subside in 1 to 3 weeks by slight pigmentation and desquamation. It's important to know the complication of erysipelas and cellulitis, because recurrent erysipelas may lead to lymphedema if not treated and the patient has recurrent attack, nephritis, subcutaneous abscess, septicemia. This photo shows the erysipelas, which has well-defined border. With this photo also has vesicle and poly on the surface of the lesion. Treatment option of erysipelas and cellulitis include rest, antibiotic, especially penicillins, aqueous penicillin G, oral penicillin, benzazine penicillin. In case of any sensitivity for penicillin, you can use erythromycin 1 or 2 grams per day for 10 days. This is a photo of erysipelas. Second disease caused by strep called strep intertrigo. What's the meaning of intertrigo? It is inflammation of skin area in between folds, especially under the breast, groin, axilla, and the other intertriginous area. Clinically presented by longitudinal painful fissures at the angle of skin folds. The skin become red, moist, and may be crusted. Intertrigo is a term caused by different causes: streptococcal intertrigo, simple intertrigo, seborrheic intertrigo, or candidal intertrigo. In case of strep intertrigo, treatment options include topical and systemic antibiotic with topical antiseptic lotion. The case of streptococcal intertrigo in baby in skin fold below the neck, because there is chronic friction between the neck and chest of the baby. the next disease caused by streptococci called angular cheilitis or bear leak. Cheilitis means inflammation of lips. This inflammation of lips caused by different causes. The etiology of angular cheilitis, which means the inflammation of angles of mouth, streptococci, candida, or riboflavin deficiency. The predisposing factors include excessive salivation, ill-fitted nature, debilitating diseases. This photo of angular cheilitis, like you see, inflammation of the angle of the mouth, characterized by erythematous, maceration, and crustation. Leukoplakia of adjuvant mucosa may be seen. This angular cheilitis treated by correction of predisposing factor, which is very important. You can give the patient vitamin B and topical application of combined steroid, antibiotic, and nystatin, miconazole, which are antifungal. So the patient treated by combined therapy of agent treated or targeted for the cause. The last disease is caused by bacteria called Corynebacteria called erythrasma. Erythrasma is a mild chronic superficial infection of the skin caused by Corynebacterium minutismum. The predisposing factors include warm, humid climate, obesity, and diabetes mellitus. Clinical picture of erythrasma usually affecting adults more than children, characterized by well-defined reddish brown or brownish scaly patches, which is asymptomatic or itchy, affecting the groin, axilla, intergluteal cleft, submammary area, or toe clips. Generalized covering of the trunk and limbs. This photo of erythrasma, characterized by scaly hyperpigmented patch. Patch means primary lesion of the skin characterized by just changing the color of the skin, not elevated, not depressed lesion, just a change in color. The difference between macule and patch is the size. The macule lesion of the skin characterized by change in the color of the skin less than 0.5 mm, while the patch localized change of the color of the skin more than 0.5 mm. So the primary lesion of erythrasma is macule and patches, and the site is characteristic for the disease. When you suspect this case as erythrasma, you can confirm your diagnosis by using Wood's light, which give coral red fluorescence. The differential diagnosis of the erythrasma include hyperpigmented vitreous versicolor, tinea cruris, or tinea pedis when the erythrasma affecting two clefts. This photo of Wood's light, which emit ultraviolet by specific wavelengths, give fluorescence in specific sun disease, and you must know the colors of fluorescence given by Wood's light in specific disease. Number 1, erythrasma give coral red color. Number 2, in case of vitreous versicolor, in case of activity, when examine the patient by Wood's light, give fluorescence with characteristic color called golden yellow color. And the third color is green, which is given in by Wood's light, the green fluorescence by Wood's light in case of tinea capitis produced by specific or special species of dermatophyte. There is Some species of dermatophyte produce material called betridine, which is the cause of the green fluorescence by Wood's light. So you must know the color caused by the color used for diagnosis of certain disease by Wood's light. It's very important question in oral exam. This is the coral red color of erythrasma by Wood's light examination. Treatment options of erythrasma include topical, systemic treatment. Topical treatment includes the treatment option sufficient for localized lesion. You can use two different treatments: sodium fusidate, which is topical antibiotic, and topical antifungal, miconazole, clotrimazole, Whitefield ointment, because this area commensal for some fungal infection. Systemic treatment indicated for extensive lesion. You can use erythromycin 1 gram per day 14 days, or tetracycline 1 gram per day 14 days, and the patient can use antibacterial soaps to prevent relapse. Summary and wrap up of this literature. You must know at the end of literature the bullous impetigo is the most common bacterial skin disease caused by staph, and the main treatment options for treatment of bacterial skin disease include topical, systemic antibiotic with treatment of predisposing factor. It's important. Eczema is a type of impetigo characterized by purulent irregular ulcers healed with scar. Cellulitis is a streptococcal skin infection characterized by ill-defined border. Erythrasma is mild chronic superficial infection of the skin caused by Corynebacterium minutism. There is many questions. You must know the answer at the end of this literature. For example, when I ask you about patient 4 years old boy presented with mild fever with asymptomatic skin vesicles on erythematous base with yellowish brown thick rust on chin around the mouth, nose, started 5 years ago. I can ask you about the primary lesion of the case, and about the diagnosis, and about the treatment option. Also, I can ask you about the diseases caused by streptococci, diseases caused by erythrasma. I can ask you about the colors of fluorescence of Wood's light, different colors given by Wood's light when you examine specific diseases like erythrasma or tinea versicolor or tinea capitis. You must study well this literature to answer all these questions. The reference of this literature is Dermatology student book.